This morning, we thought we had some sunshine, didn't we? It looked like we might finally have our own domestic inquiry into the treatment of gender dysphoria, the condition where people feel trapped in the wrong body. As the Australian reported today, the South Australian Parliament was likely, it said, to support an independent MP's bid for a parliamentary inquiry, with Labor MPs reportedly pushing for a free or conscience vote on the issue. Now, I'm sorry to report that late this afternoon, the South Australian Premier killed off any chance that those Labor MPs might have had a conscience vote, with confirmation that Labor would now oppose any such inquiry. Now, why the cone of silence here? Why is every left-leaning MP in the parliaments around Australia blocking expert inquiries into an issue that we know is growing year by year? If the governments are so sure they're doing the right thing by our young people, then why are they so afraid to let health and medical experts speak? And parents too. In 2020 in South Australia, there were just 58 children and adolescents being treated for gender dysphoria. Just a year later, that number has more than doubled to 149. Now, this treatment can involve puberty-blocking drugs and hormone treatments. In some cases, it involves surgery that's impossible to reverse. And many are concerned that unlike just about every other condition, the treatment seems to involve more of the patient's diagnosis than that of expert doctors. Now, if otherwise healthy people suddenly announce they feel grotesquely overweight, for instance, and then deliberately starve themselves, doctors don't normally take their word for it and prescribe appetite suppressants. No, anorexic patients, they receive a range of mental health care and are encouraged to appreciate and love the body they're born with. But thanks to constant pushing from the extreme trans lobby, doctors are expected to affirm children's own assessment that they've been born in the wrong body. As a result, hundreds of young people who we don't trust to vote, to drink, to drive, or legally have sex have been trusted, though, to make the shattering and life-altering decision to take powerful drugs that could cause sterility, and in some cases with the involvement of the courts rather than parental knowledge, let alone permission, have their sex organs removed. It's an absolute scandal that we've allowed this madness to go largely unchecked without any expert inquiry up until now. In Britain, a government inquiry into this issue led to the closing down of the infamous Tavistock Clinic and the abandonment of so-called affirmative care for those mostly deeply troubled youngsters. And what the Tavistock inquiry has shown us, many of these young people are on the spectrum. They are gay, not trans, or they lack access to mental health support. In Australia, we've had nothing up until now, up until this talk today in the South Australian Parliament, even though young people who end up regretting their lack of care now only have courts as their redress, like the case of a Sydney woman currently suing her psychiatrist for negligence after undergoing the surgical removal of her breasts and her uterus after just one consultation when she was 19. Now, a 15-year-old girl who thinks she's a boy or vice versa normally needs help to overcome the doubts and anxieties that many teenagers have about their sexuality or identity. Confused young people need the best care modern medicine can provide, fact-based care, mental health support, not some medicos who seem keen to just agree with what a child merely declares without adequate contestability. And not in the case of young adults, chemical castration or surgical mutilation at the hands of a medical establishment that's been browbeaten into submission by the trans lobby. If we're serious about child protection, then an inquiry like this is what we urgently need. And at a federal level too, not just in South Australia. If the pro-trans lobby are so confident that this is right, then they should welcome an expert inquiry rather than run from one as they repeatedly try to do. And every doctor who believes in the Hippocratic oath of first, do no harm, well, they should be honour bound to support one.